who are oh, thank you, Kate. Yes,
Sorry, Helen.
we are recording the session also. That's right. Just a reminder to everyone. Yeah, so the Drumheller group has been participating in the Health Canada grant, and they're going to be presenting on their experience with us and kind of some of the learnings, that type of thing with it. So we're going to start with their PowerPoint and then move into ours kind of after that. So I'll hand it over to Kimberly and Lisa and Amanda, I think. There we go.
All right, good morning, everybody. So we work in Drumheller, and I'm Kim.
And I'm Lisa.
And we're community recreation therapists with AHS.
And my name is Amanda, and I'm a primary care nurse with the Big Country Primary Care Network.
All right, so we are part of the Drumheller Community Seniors Coalition. So we're just going to go a little bit through how that came about and what we've been up to in Drumheller.
So for our group, we started, or who's involved in our group, other than the three of us, we also have 𝘮𝘮𝘭𝘵𝘮𝘭𝘏, who is a seniors outreach nurse through Alberta Health Services. And we contact her for all of our referrals for in-home assessments. And new this year to our group was Karen with the town, and she works through SCSS as our senior services coordinator. So helping us with some of our education and community events. We work together to provide services and ensure that no one in our community falls through the cracks. So how we got started. So this is a project that Liza and myself have been working with the FIGSI team. And since about 2017, we kind of started learning more about these senior community projects and the work going on in other communities, and started working on what we could do here in Drumheller. We have always been really a creative and innovative team. There's been lots of challenges throughout the years, but we're still, determined to support seniors in our community. Kim and Lisa joined us last July. They had a temporary position as community rec therapists, and it was through the COVID Uplift grant that they received, but their position is going to end here at the end of September. So they've been a real great asset to our team. Karen came on board again earlier this year as a new seniors coordinator, and it was just great to have, again, some fresh ideas and new motivated people on our team. We meet with FIGSI. We were originally meeting on a monthly basis, and now bi-monthly basis to go through the Wellbeing Guide and set out our key learnings and work plan for the Health Canada grant.
So as far as the activities that we've been doing, so based on the work plan that we generated from the Wellbeing Guide, we've been able to implement several things in our community. So the first one is, we call it the Senior Circle of Connection. It's an adult day support program, and it's held weekly every Tuesday afternoon. And we provide meaningful activity for people living with dementia. And we also target people that are at high risk of isolation, that don't have social supports or family support networks. And it's for 2 hours. So the flip side of that is that it also gives the caregiver 2 hours of respite every week.
And so tied into our weekly day program, at the last Tuesday of the month, we hold a caregiver education session. So that is for the loved one to come, and it's in the same building. And so we've paired with the Alzheimer's Society, and together the five of us come up with ideas, and we have a volunteer who's very successful in helping with those caregiver education sessions.
We got a grant. Our coalition got the ABCD grant from the Rural Development Network. And so we were able to start a memory cafe in Drumheller, and that's held once a month. And it's again for people living with dementia and their care partner. The goal is for it to provide something for them to do together, so they can kind of step away from that caregiver care receiver dynamic for a little while every month and come and just do something fun together. So we've had several outings into the community with that, and it's been really, really great so far.
So we have a recreation therapy assistant. Her name is Rachel, and she has taken the Opening Minds Through Art training. And we had her run a 5-week, we call it 𝘮𝘗𝘬 program in the community. So with some of the people that we see in our day program, as well as other community seniors. And she ran it for 5 weeks. And yeah.
And so that kind of culminates with an art show. So on September 13th, we partnered with the local library and we had an art show to display the artwork that the community seniors had worked on in the program. And we've also partnered with the library to keep them on display. And so on, well, I guess September 30th is the wrap up. So all of the art pieces are available for purchase by silent auction by community members. And the money from that will go right back into the 𝘮𝘗𝘮 project to buy supplies and to try to make it a sustainable program. So AHS did provide the funding for Rachel to run that program in the community as far as the staffing, but we need to purchase all of the supplies and everything to keep it going.
And so this Thursday coming up on September the 29th, we are hosting a seniors fair at our Badlands community facility here in Drumheller. So we have 4 guest speakers, which include the RCMP is doing a presentation on scams and cyber safety. And then we have Tricia Tetz, who is a recreation therapist at a Red Deer, and she's going to be speaking on dementia and the Teepa snow gemstones. We have Vicki Hardy, who's going to be talking about seniors housing and what that looks like here for our Drumheller seniors. And also we have Martin Sweeney talking about substance abuse in seniors. So outside prior to, or just outside the hallway, there's going to be a vendor trade show as well. So I think we have 8 or 9 tables set up for that.
And we're very excited.
Yeah.
And then just lately, so in September was the first one, we've started a men's coffee crew. So we noticed in the community, there was a high number of men specifically who just needed a social outlet, and they maybe aren't comfortable going to the senior center. They feel like they don't maybe fit there. So we've started a men's coffee crew, and it's just a drop-in social coffee group. And it's the 2nd and 4th Fridays of the month at just a local, it's at our Friesen Brothers, which has a little cafe, but it's also a grocery store. So when we invite the men, we say, come for coffee, and while you're here, you can grab some groceries for supper. So we try and get them to do a little bit of both. And that's been great. We've had 2 so far, and they've been really, really good.
So also using the results from the Wellbeing Guide, we have supported local seniors. Providing subsidized transportation to community group programs. So for example, in our weekly day program, we will set up for one of our couples to use the local transportation, which is the Valley Bus. And also when we do our memory cafe, we use the Valley Bus or Bubba T's bus service. So the town of Drumheller covers the transportation to the day program, but the coalition has provided the punch card passes for the clients to use and attend our other programs. So we also have put together monthly calendars with programs and events for 55 plus, and also posted on the Town of Drumheller Seniors website. So with those calendars, we do a community mail out. So we did one in June of 2022 and September. So they have been very successful. We paired with a copy company out of Hannah, and they were very, very good to us. They had the printing and done and stapled and everything else together within days. And then we'd get that information out to mail it out to all the, I guess, Drumheller and all surrounding areas. So
it's like just a mass mail out through the post office. So we just take 2,100 mail outs and drop them off, and they distribute them. And we found that was probably the most cost-effective way to get our information out, for sure. So we just wanted to include a little visual. This is a networking map that the FIGSI team had put together for us. So we take no credit for this map at all. But it just kind of provides a visual of the different connections that have been made within the Drumheller community. So from the different teams, the rec therapists, the provincial team, PCN, and just shows how we're trying to reach out and trying to connect with as many members of the community and different community groups that we can to try to serve the seniors in our town.
Wellbeing.
Yeah.
So the Wellbeing Guide has also helped us to prioritize our work in the community. So we knew that there were large group gaps. And so this Wellbeing Guide has helped us to pinpoint the work that could be done to address the needs. So we also made sure we didn't overlook any area or target group, people living with dementia, carers, or the community. So it also showed the overlap of people living with dementia and caregivers and how their need can be similar. So certain programs or initiatives could benefit both target groups.
As far as our key learnings from going through the Wellbeing Guide process, we learned that it's key to collaborate with other professionals in the community. It leads to far greater outcomes than working alone. Outcomes include better brainstorming, problem solving, creativity, more ideas, and a far larger and multifaceted outreach to community members. So by working with the PCN and the Seniors Outreach in AHS and the town Senior Services Coordinator, we found that we could find the people that really needed the connection. Another key learning was that the community mass mailouts were great. They were such a money well spent for us for the grant money. They're a way to reach many people. So we did 2 mass mailouts and we reached over 4,000 households. So for us, we just thought that was a really good way to find people. And that way you're not missing people that maybe don't listen to the radio, or maybe they don't read the newspaper, or they don't have a computer to look on social media, but everyone gets their mail. So that has been really successful. Another key learning was that the need for community-based programs for seniors, especially those living with dementia, their care partners, and those at high risk for isolation, is there and it's real. And most importantly, we've learned that the community-based programs make a difference. Another key learning was not to be discouraged if you start a program and it's not well attended initially. The saying is, Rome wasn't built in a day. So an example is our Circle of Connection, so the day program that we hold every week. We started in October 2021 with 4 participants. We now have 15 people registered in that program, and we average about 9 to 10 every week. So just that, you know, if you offer it, sometimes it takes a little while to find the people that really will benefit from those programs, but it's important just to keep putting it out there, and it'll get there.
We've certainly seen some great success, especially over the past year with Kim and Lisa joining our team. So what contributed to our success is certainly the passion and the knowledge that our team members have. So we do know we have a really great team, our small group of 5, but very experienced and very passionate ladies who work with us on our team. And we share a common goal, and we share a drive to improve the lives of seniors in our community. So that, you know, we got a lot of work done in a really small amount of time, and we could see, you know, we all, you know, pushed to our limits, I think, to see how much we could do, and it was really successful. The rec therapy position was key to actually achieving our goals. We have had tons of ideas. We've seen these gaps for a number of years, but we didn't have the bodies to do the work. And we saw that, you know, having 2 committed team members who were out there in the community every day, running our programs and calling people and meeting with people, made such a difference. To see our numbers grow in our day program, to see, you know, the registration numbers for our seniors fair, which is double what, you know, it has been 2 years ago when we did our last one. You know, we're seeing the impact is huge of these positions. Barriers, of course, is lack of funding. Their position ends the end of this week. So we're pretty devastated by the loss of their ability to work with us in the community. And it's really going to impact our sustainability of programs going forward. You know, we've lobbied for, since 2017 for AHS and for the government to support these initiatives and back their claim, to support people in the community, but they just keep cutting any funding we try to get our hands on. So that's certainly a barrier. It really puts a lot of pressure on the three of us that are left on our coalition to try to continue pieces of this work. We know we're not going to be able to sustain it all. So now we have to pick and choose what programs we keep and what programs we have to let go. So that's really tough. Barriers is, like I said, lobbying the government. We've proven and we've evaluated and we've had such great success, and no one seems to be hearing us. So we're going to keep making some noise in our community and, through all the channels we can find, to see if we can make changes in the future and get some sustainable or some secure funding.
So that wraps up our presentation. So I think there was time, hopefully, for a little bit of anyone has any questions or discussion.
That's great. Thanks you guys. That's so inspiring to hear the work that you've done there, and absolutely can feel the passion that you're talking about from your team there. Are there any questions from the group here?
I just have a comment, Helen. It's 𝘮𝘮𝘦 𝘗𝘓𝘗𝘢. I work in health promotion, and prior to my colleague Christine, who now covers Drumheller and Hannah and Three Hills, we actually did some focus groups with the key partners with those different groups, trying to build a case to get more funding. And I think we've tried all sorts of everything, and hopefully something will tweak somewhere, that because this is such an awesome asset to the community and such a great model for other communities. So
thank you, 𝘮𝘮𝘦. Yeah, I know a lot of work went into those into that proposal.
I didn't have a question, but I had a comment. It was encouraging to hear the determination and the not getting discouraged, because it's so easy to get discouraged when things don't seem to, you have these great amazing plans and then no one shows up. So that was really encouraging for me.
I think one of the things that the team had shared with us was, and maybe you can speak a little bit more to it, the Drumheller team, was around being able to reach people who are hard to reach through some specific activities. I'm thinking of your 𝘮𝘮𝘭𝘵 program, and you had talked about that with us. Maybe you can say a little bit more about that.
I think what is key for Kim and I weekly is touching base or well-being calls. We often every morning, like every Tuesday morning, we call our people that come to the day program, and every morning prior to our 𝘮𝘮𝘭𝘵 program, we call those participants. And even I hear through the comments of the seniors attending our programs that even those calls, they look forward to those calls weekly, and just to check in and to say, you're come to our program today, this is what we have going on. And they look forward to the calls, they look forward to the programs. We've had huge success that way. So,
and they've also said that without that call, they probably wouldn't come. So I had a man comment actually from my men's group Friday, and he said, I'm at home and we always send out little postcard reminders. And he's like, I know what day it is. And I know I'm thinking, am I going to go? And am I not going to go? And then you call and I'm like, well, I guess I'm going. She's going to wait for me there. So that, it just kind of helps them spur that on. And there are other community organizations, like there is the Pioneer Trail. It's a senior center, and they do have coffee and they do have cards. But they don't always fit everyone. So the people that we're targeting are people that either aren't comfortable, or because of memory loss or cognitive decline, they're not able to go to the senior center and they don't feel comfortable interacting there. Where the groups that and there's also no one facilitating there. So they know that they're coming and one of us will be there, and that we will help them go through the conversation, and we will cue them, and we will support them to have a positive and meaningful experience when they're out. And so that's not something that they get necessarily anywhere else.
Yeah.
And we don't give up on people either. So we've had some people who we offer the day program and no, they didn't really like it. It didn't fit for them. They weren't comfortable. So we just keep trying. So, you know, we keep calling them about the next program and the next program. And the 𝘮𝘗 program was great because it was very different and it was very small group. And we had kind of a 1-to-1 volunteer ratio. And so we had a couple of people who are unique in their personalities or unique in how they present in a group, and they thrived in this group, and they were so happy to come and have fun and feel comfortable in this group. So another piece of it is just not giving up. If this program didn't fit, well, then we were going to try to find something else for them.
And I think that was the benefit for Lisa and I coming into this position and meeting with Amanda and Liza and Karen, because they see the clients in the community. They know who's out there. And so a lot of our meetings were, okay, them saying, look, this is what we're seeing. What are we going to do about it? And then us being able to work as a team, and Lisa and I being able to put those into action, like, okay, let's try this. Nope. Okay, how about this? So yeah.
Yeah. Oh, I love that persistence. That's so key. And, you know, just speaks so strongly of the role of building those relationships among you as a team to be able to share those ideas, but also with those folks who, yeah, it's going to take a bit of extra work, kind of some unique environments that you were able to create for them to really help them start making those connections, right? And to be able to leave their homes. Really, really great work, you guys. Yeah.
Yeah, it's that value of reaching in to them rather than waiting for them to reach out, right? For what is it that they need? Yeah. Yeah, beautiful. Such great work.
Yeah, which speaks to that needing the resources to be able to do that,
Yeah.
right? All those components are fit together. Yeah.
There was a question, I mean, lots of great comments in the chat box of the wonderful work that you're doing. There was a question around whether or not the 𝘮𝘗 silent auction was available online.
That's a good idea.
Another good idea.
Yeah, no, we don't have it online actually, but that's something going forward that that Amanda will have to look into.
For sure.
Good idea.
Okay.
Yeah, that's a great idea.
Yeah.
A couple of hands up there. Sorry, Helen.
Yeah, you bet. Shauna, do you want to go first, and then we'll hear from Andrew?
So first, I want to just echo the kudos and the virtual congratulations. It's just heartwarming. I'm thinking about some additional value on those persistent sort of reaching in. Have you, with those regular conversations, have you been flagged to health concerns or cognitive decline or those types of things with the folks that you reach regularly, that have been able to, like, oh gosh, you know, Mr. Jones was not himself today, we should maybe keep an eye on him, types of things?
Yeah, absolutely. Yeah, for sure. We've there's been many times that after the day program weekly, it's been a conversation with Amanda, either that afternoon or the next morning, to be like, hey, this seemed really odd, or, you know, did you know that, you know, so and so actually hasn't left his house other than this day program? So yeah, definitely lots of good feedback. And I think because our team has been quite cohesive, there is a lot of open dialogue and back and forth conversation, for sure. And then we've also been able to, I think, through that, help people transition a little bit better. We had a lady that was very determined. She was staying in her home, very determined, didn't want to come to the day program, didn't want anything. And so Amanda had worked with us to try to get her there and with her family, and we finally did. And after a few weeks, she started to open up, and she would laugh and she would engage in the conversation, and it led to a positive placement. So of course, we can't always keep people in the community. It's not always what's actually best. So this lady did need to be placed, but it completely changed her attitude. She was no longer afraid of being in a care facility. She was no longer afraid of interacting with people. And she said to Amanda, she's like, I just want to be somewhere where I can have coffee with people every day. So
You're giving me goosebumps.
Yeah, it's definitely, I think the open communication in our team and what we see in our participants has been huge for their well-being.
So, and another
Wow.
thing, on Tuesday mornings, we do the call outs between the three of us. But also Amanda comes and is the greeter at the door. So I'm in the program, she's at the door. So between the two of us, if there is a concern, or Amanda can tell me, you know, so-and-so is not feeling great today, or keep an eye out for so-and-so, or so between the two of us on that day of the program, we kind of keep each other obliged on what's happening. Also, you know, if there's mobility needs, you know, we've had some, our volunteers for our day program, we've kind of handpicked and are retired registered nurses from the community. So, and they have been an asset in the day program. And so what they see too and pass on to us, and then we pass on to Amanda, and we kind of all have that open communication. So works
Wow.
well that way.
Super. Yeah.
Oh,
Well, and
well done.
these
Yeah.
ladies hear things in the day program that patients don't tell their doctor at the clinic. So it's like the
Yeah.
housekeeper at the hospital. They tell these guys that they fell last week, but they don't tell their doctor that when they come in for a checkup. So it also gives us some very good collateral information
Right.
to see to hear what's actually going on at home, because they put on a really good face for the doctor.
Yeah, for sure. That's right.
Yeah,
Okay,
so
we
true.
got a couple more questions here. Andrew, I'll go to you next, and then to Wendy.
Thanks, Ellen. I just had a question for you guys, because you brought up in the barriers how obviously, you know, resources and funding seems to always kind of be something that you're always kind of in the back of your mind, you're always thinking of. And, you know, we know in that kind of process, the metrics that they use are kind of sometimes unfair. Like they'll typically say like how much or how many members of the community think you're actually going to reach with this, you know, what kind of success rates have you hit, or, you know, have you been able to access your target population? But from hearing you guys this morning, I think a lot of those more anecdotal, more case studies, more, you know, the story of that one individual who really wasn't with the program or really wasn't getting behind it, but slowly kind of got their way into buying into a little bit more of what you guys were doing and kind of carrying forward. And also even like how within your own team, a lot of the like nuts and bolts and a lot of the, you know, you play this role, the kind of quarterbacking that you guys do to be able to kind of reach everybody, those things are so important, but they're so hard to weave into those proposals and weave into those kinds of, you know, pitches for funding. Like, do you guys have any, like, are you guys tracking a lot of those kind of more, you know, opportune stories where you did hit, you know, a target individual and kind of grew and expanded their, you know, reach within the community, and just how you guys are tracking a lot of the stuff, like the stuff that doesn't always make it to like the surface of those kinds of things?
Yeah, for sure, definitely. So so we have in AHS recreation therapy, we have a professional practice lead, and so she has done a ton of work on that end of it, on the numbers and on showing through these uplift positions how many people have been reached, how many new initiatives have been started in each community. And so that all has been, it all was submitted to Alberta Health Services. We did submit a formal proposal for funding for in an effort to make these positions permanent, and AHS denied it.
Oh.
But it was definitely, like you said, it has to be numbers based. We know that you have to be able to quantify what you're doing. And so our PPL had done a fantastic job of that, but it was still denied.
Yeah.
So super disappointing.
Yeah, for sure.
Yeah, I
Absolutely.
think collectively there's a large amount of disappointment on the line. I think we
Yeah.
can safely say
Yes.
that.
Yeah, for sure.
And that you have achieved such amazing things and are so enthusiastic and committed to the work. It's just such a beautiful example.
Yeah. Wendy there, we'll go to you next.
Yeah, thanks, Helen.
Mhm.
So I wanted to say congratulations to you guys and for doing such an amazing work there. I certainly share your sentiments with a lot of the things we were doing in Ennisville are very familiar. What I'm wondering is that now that your team, right, is going to be cut down, what do you think is sustainable for you guys? What do you think is doable? What's sustainable regarding some of the work that you've done, right? What are you going to be focusing on to sustain that?
So we're still trying to figure that out. So it leaves most of the programming onto my caseload. So I have to balance my work at the clinic and the demands of chronic disease management with what I can do in the community. You know, thankfully in Drumheller, our PCN team is really supportive of this work. They've seen me in the trenches for the last 7 years or 5 years, I guess, trying to keep this programming going. So they've been really supportive of my time and quite flexible with my time. But again, you know, we're looking at the numbers, right? What programs bring in the most people and the most touch points. And certainly the respite for our caregivers is number one. Again, we're trying to pick up the deficits of Alberta Health Services. So home care is denying respite to our community, to our caregivers. They are short-staffed or whatever the reason is behind it. So that's definitely a priority, is to keep our day program and our respite going for those caregivers. Because there isn't any other option. So yeah, it's some tough decisions, and will, again, short-term and long-term look a bit different. In the short term, I will, you know, sacrifice as much of my time at the clinic to be out in the community, but that isn't sustainable long-term. So some tough decisions to be made. And again, I feel like we're constantly covering what AHS is dropping.
Yeah, I'm just wondering too, though, you know, we are lobbying as healthcare professionals and stuff, right? But I'm wondering about the community too. If those guys have seen that benefit, right, through the participants, other organizations, whether it be FCSS or whether it be, you know, the town council, whatever, do you think they would lobby for what you guys have done? Have they said, hey, we want to support this?
Yeah,
sure.
yeah. So yeah, we are trying to figure out, I guess, who our key contacts are within AHS for those messages to go to. We have had some outreach, definitely from some of the people in our programs, from the caregivers, from the town. So we definitely will be doing some, yeah, we will promote people to lobby for those services. Not that we can tell them to, but we can definitely give them the contacts that they need should they decide to do that.
Yeah, and Kim and Lisa, sorry, the other thing I would suggest you pass on to your clients, and again, I'm AHS as well, so well versed with your programs, is to have your clients, if they're upset with you guys leaving, is the AHS complaint line.
Yeah.
And that is open to anyone. I would be handing that number out like a business card to anyone and everyone, because again, that's the only way you're going to make changes, is to put pressure on them.
Yeah, so I actually wrote that number on the back of our business card, and I have them ready to go.
I think
Yeah,
that's struggle.
That's what the line is for there, right? Is to hear about those changes that it's sometimes get lost in other noises that are going on, right?
It is really hard, though. We do find it's really hard to ask families to do that then when they're struggling so much in their role. You know, these caregivers get 2 hours a week of respite, and that's the only 2 hours of break they get in a week. So it's really hard to encourage them or ask them to do one more thing.
Yeah.
So that, you know, we also appreciate that really they're struggling where they're at, and it's really hard to ask them to do something more.
That's a really good point, Amanda. Yeah. And when you got the information and just are trying to get it to the right, in front of the right folks, that's right. Yeah. I think earlier, just in the chat box there, Sharon, you had suggested talking to the Alberta Association on Gerontology. Just wondering if you can say a little bit more about that and what support they could be.
Yeah, actually, we seem to have a direct line to Corinne Schaum, which might be helpful.
At Alberta Health, yeah.
She's the assistant deputy minister now, is that right?
She's the assistant deputy minister too, and you know, so they always are talking about moving those integrated services closer to home, and this is a perfect example of supporting family caregivers, supporting people with dementia to live well. And you know, the question is we cannot just have these little pilot projects. There has to be, that money has got to be moved to these excellent programs, and they have to be sustained.
Yeah, thank you for that, Sharon. And for the Drumheller team, if you aren't sure how to connect with Sharon, we can certainly facilitate that afterwards too.
Thank you. Thank you. Thank you. That's great.
I think that brings back Lisa Basisti. You had also had a comment in there just around relying on
speaking-
grants and then the funding ending, right? So this is certainly part of a bigger challenge, as you've indicated, Sharon, the projects that with the stop starts and the impact of that on real people, real Albertans, right, who are devastated by those decisions. So,
You know,
yeah,
and on a
lots of
bigger,
factors there.
yeah, absolutely. And on a bigger scheme of things, you know, that's the tough thing with AHS. And this is, again, my opinion, not AHS. We look so much at crisis intervention where you get much better bang for your buck if we do some prevention. And all of the stuff that you guys have been doing in Drumheller and Three Hills, and, you know, same with us in Innisfail and Lacombe, some of those, that was all prevention. And look at how many people you guys connected with and provided that support, that caregiver relief, all of those things. Again, that's that huge piece within healthcare that we never put dollars into it. All they can see is crisis intervention. Throw it in acute care, throw it in emerge, and I get those are heavy areas, but if we can keep them out of those locations, that's better bang for our buck.
Yeah, and I think that there's, you know, through the pandemic, we really saw the impact of social isolation and how detrimental that is. So to me, it's almost further in than prevention, because if we don't do it, like it's like not giving somebody medicine, right? We know they're socially isolated. We know it's having an impact, and yet we're removing the things that will help them recover from that, right? So I'm thinking we're further in than the prevention scale of things, but that's a perspective that I think we have to beat the drum about also with it. Yeah.
I do wonder, and I think, Sharon, of your comment around Corinne, you know, when we think of the broader work that's happening with all the teams that are represented on this line, perhaps having someone like Corinne or someone from her team coming to this venue to provide some suggestions as to how to flag those local barriers up to that level of decision makers, because I think there's a haphazardly it can happen if you know someone who knows someone, but it's such a labyrinth to be able to connect, to know who to connect with. So let's put that on our idea list for having as an opportunity in a future partners meeting.
Yeah.
Sharon, I'm wondering if you would be okay if we shared this recording with the senior operating officers for Central Zone, because I had an opportunity to meet with the health minister in some community settings, and I did bring up this program at there, and you know, it sounded very hopeful that we just haven't hit the right people with our requests. So I am hoping as we move forward that we might get some momentum.
Absolutely. The recording will be on the core website, so anybody can access that. So it's there to use as would be helpful to you guys for sure.
And so if I can just pop in here, I think too, if we come at it from different directions. So I know the government has just put a whole bunch of money into elder abuse. I mean, I know we don't want to go down that road, but if we think about these people that don't, the caregivers who don't have respite, you know, they just need a break. And so whether it's intentional or not, that they over medicate their, you know, like I said, we don't need to belabor this, but if there are pots of money in other places that could potentially be linked across, I think we have to be open to that too.
Yeah.
Did they not also make an announcement yesterday about putting more funding into PCNs?
Did they? I didn't get that myself, but that's maybe I'm just behind on where that's
Helen, was
from.
it PCNs or was it primary care?
Oh, it might be primary
Oh, it might have been
care,
primary care. Maybe that's what it was, primary care.
I believe that. I didn't read it yet, but I believe that there is some establishment there, and I was thinking about how this exact program could work toward that. I'm not sure, but it may be worth checking out for sure.
And I think one of the people that we're always in contact with and updating about the work that is happening in the communities is Dr. Richard 𝘮𝘮𝘮, and he's on he's a co-chair of one of the panels that's been set up by Alberta Health to look at primary care and how to do integrated care and get into this prevention, pre-prevention kind of area too. So we are bringing these stories to him all the time also. So I think you're absolutely right, Stephanie. Let's keep at it in all the different directions that we can with it, because we've got some wonderful examples here. Yeah, that's great. And anything else from everyone? This is such great discussion.
Yeah, I just wanted to say, I think it's been sort of great suggestions and what have you, but I think we're, this is again, just my opinion.
Yeah.
I mean, everybody's doing so much great work, right, at this level. You know, when you think of the guys in drum there, right, we are sort of a little way down the totem pole somewhat, even though we do know that there needs to be a system change, and we do presentations, right, and to senior management, and they say great job, and this is, you know, great, and then tap on the shoulder, right, and then but nothing moves forward. So I mean, I don't know what the answer is, right, as far as, you know, who needs to take this on, as far as that from a systems perspective, that who's up the chain of command, right, to say, look what's happening in rural Alberta. You know, and this is ground roots individuals, right? It's usually, you know, allied health led through social workers or nursing led, recreationally led, right? And they're working collaboratively together, which is, you know, a change, right?
Yeah, it absolutely is. Yeah.
And you know, bringing in other health providers, stakeholders, and things, and you know, like what a lot of people have said, you know, we're all doing projects constantly. You know, we just need to reach somebody who's going to really champion this to say, guys, look what's happening, right? And it's very doable. I mean, it's not rocket science. It's so doable. And you don't have to throw a lot of money at it either.
Yeah, no, the return on the small bit of investment is huge. Yeah, Kim, there, I see her.
Sorry, I was just going to say, Wendy, I think that's been one of our biggest frustrations in the last couple of months from Lisa and I, for sure, is finding someone who will listen, who can actually do something about it. So you know, it's been put up to our, like I said, our professional practice lead had done a fantastic evaluation of the program and a briefing note that went into AHS. Then it, you know, we've reached out for sure to our director, our manager, and then our director. But when the answer that comes back is no, and the reasoning is no based on funding, and we basically were told that we don't have to like the decision, but we have to live with it. So it's difficult for us then on the front line when we see all of this to then know what to do with our passionate energy. It's like no one is listening. So I think you're right, Wendy. It's like, how do we find someone that will take this forward who can actually make change?
And maybe it's trying to us coming together to kind of be able to represent how different groups are bringing that forward, because I think that's sometimes part of the problem is that, you know, Tammy was talking about, she has people that she's able to talk to, and Sharon suggesting this connection with Corinne Shom, other people that we've talked to, and maybe there's a need to be able to actually show that so that we can see what progress is being made, that part of it too, because I think we're we see Healthy Aging Alberta, they're doing work kind of in this area also. So being able to be really visual about it, I think can help us also have the energy to keep doing it, but also then it shows a bigger push to the people that we're talking to as well.
I think, you know, just putting the offer out there, we, our team takes our role of advocacy for teams like you very seriously. So, you know, I think, Tammy, if there's anything we can do to support you or provide to you in terms of anything you're doing, but that goes to any of the teams that are participating. If we don't have a connection, we'll do our darndest to dig up someone who does have a connection to help bring forward. So it small words, but we do take that advocacy of that local work very seriously, because we see the impact that it has locally and the importance of it. So let us know in any way if we can support.
That's right. Well, thank you to the Drumheller team for for a great presentation and
A round of applause.
generating,
for sure.
a round of applause, and for generating such great discussion within the group here. We do have just about 15 minutes left, and I thought that we had wanted to spend a little bit of time on looking forward kind of after Christmas to the partners meetings and what type of presentations we'd like to have. And I think we've started some of that discussion already here. How can we bring folks to this meeting who have some ability to make some decisions and investments and that kind of thing. So we wanted to be able to have a bit of a discussion around that also. Thank you, Kate. This is what we're looking at. So the September 22nd to December 2022. So there, just for people who are new to our group here, the partners meeting, this meeting has been an opportunity for the rural teams who are working in Health Canada, but also some of the other ones that have been connected with FIGSI before that to come together to do some learning activities, as well as share what's happening in their communities as we're hearing today, and we hold it on a monthly basis there. And so we're looking for input onto that January 2023 through June 2023. We kind of have these 2 seasons of the partners meetings. Some of the things that we've looked at and engaged in last year, we had a couple of roundtables where we heard from each of the communities on the activities that were happening and the challenges that were happening for them. We had the Alzheimer's Society come and present about the engaging with people living with dementia. There had been some questions about that. The Tamarack Institute had come and done a storytelling webinar. We had a leadership engagement panel that we found very, very helpful also. Core Alberta, who were now holding our meetings through, came and did a presentation. And Nora Keating presented on connecting local work to the international priorities that are happening. The Dementia Advice Line came and spoke, and Val is here today also, the Health League, that's 811. And then we had 𝘮𝘭𝘵𝘮𝘭𝘮 and I'm trying to remember, Karen McDonald, there we go, Karen McDonald, come and talk about CORE, specifically around CORE BC and some of the overview of their community supports and for older adults and some of the things that are happening within British Columbia. So just wanting to, oh, by the way, Dementia Sean is telling us that it's the 7th anniversary of the Dementia Advice Line tomorrow there in the chat box. Congratulations.
Happy anniversary, Val.
Yeah, that's right. Yeah. So yeah, just wanting to hear from the group what other ideas that you have, can be topics, can be speakers, kind of a focus of what we'd like to work on during that January to June that we'd see in the partners meeting. And please enter it in the chat box if you have ideas. One of the things I was wondering is, do we want kind of a balance or where the balance should fall in terms of bringing things like the Dementia Advice Line. In the past, we'd had the some of the groups from the CIDC grants come and present what they had been looking at. Karen, you're saying there the idea of change makers is important. Yeah, to be able to have them hear what's happening and have some discussion. Yeah.
I do know there's lots of people doing a lot of work, right? When you look at what the United Way is doing as well, right? In Calgary, but also I went to a webinar the other day on building a better system to support Canadian family caregivers. So, I mean, I think to align some of the things that we are doing, maybe just like last year, right? You have these people that come and present on different things, because I know that the build that went around caregivers is going to be huge.
Yeah.
Was that someone through Caregivers No, it was a national one, Wendy, was it?
Yes, it was. It was. I know Jenny, Dr. Palmer, you know, because she's obviously quite involved in covenant care, and
Okay.
it was Canada wide, because
Okay.
Ontario did a lot of work, and they
Mhm.
on it. They they have a lot of different programs compared to Alberta, that's for sure.
Yeah.
It
I
was
see
really
Sharon's just
interesting.
slipped
It
off
was
the
great.
line, but we can follow up with her. She works with 𝘮𝘧𝘦 then as well.
Yeah,
Yeah.
because she was there.
Okay.
She was the facilitator.
Okay. Great. Thank you, Wendy.
I'm just seeing in the chat box here ideas around from Stephanie about connecting with some of the other groups on healthy aging, Alberta Core, elder abuse, senior falls. So having some of those folks come, I like that idea for sure. I think, and Judy talking about having someone from Alberta Association on Gerontology to discuss the Futures Policies Forum and the work that's happening there. To have Sage come and speak, Lisa. Yeah.
Great suggestions.
Just making
Yeah,
some
great
notes here.
suggestions. Sage. Awesome.
Yeah, and I think you're right, Wendy. The caregivers areas is just a one that would be great to have more connections with, also that for the people who are doing the work. Okay.
And if you come up across other ideas or presenters, you know, our inboxes are always open to suggestions. So please just forward those on to us.
Yes. Yeah, that's right.
Yeah.
Okay. Yeah. Serving Indigenous communities.
Yeah. Thanks, Val.
Yeah. Yeah. Oh, thanks for that, Peggy. So there's a link there to the elder abuse group is having an event next week, understanding domestic violence and dementia care. People can have a look at that also.
I think we have to look at the elder abuse part of it, because actually Alberta is the highest incidence of that in Canada, right?
Yeah.
And you know, for what reason? Why? Like, we need to. What is it?
Yeah. Yeah. Well, I think
I think
if you look at isolation and, you know, if we're not putting the resources in there, then again, it's another one, you know, when we talk about that prevention, well, is it really prevention when we know what will, you know, stop something from happening, right? But yeah.
Well, and I think too, I mean, somebody had mentioned earlier the social determinants of health. And so, you know, going bigger, perhaps Alberta is also, I can't remember if it's in families or I can't remember what demographic it is, but we're also the highest for food insecurity.
Yeah.
So, you know, what wonderful things that we have, highest for elder abuse, highest for food insecurity. So, you know, there's a lot of things that are probably underlying a lot of social determinants of health that are probably common denominators for these things. So sort of digging deeper into that too might be.
Yeah. Yeah. And I think that's, you know, I'll just tie it back into our well-being kind of concept and that well-being guide that really digs into what are those material, relational, subjective things that contribute and show us the gaps of where we might be able to address it. Yeah. Just seen there from Val that they've launched they have a newly launched Indigenous support line. And could explore their, oh, that would be great, Val. Yeah, to have their senior clinical practice lead come to present on that.
Okay, great.
Yeah, we recently had a conversation with Calgary Alzheimer's. We've been doing a bit of a community of practice group every couple of months, and we had her come and chat about, you know, dementia from an Indigenous lens, what fits, what doesn't fit. So I think it would be a good conversation for sure.
Yeah. Yeah.
Lisa, I just see your comment there about the HQCA's campaign. Was that related to the elder abuse part?
No, it was relating to, where to go for your needs as an individual, like if it's to the pharmacy or asking those questions around your health. And I just thought it was more broad, but I think it would really focus along the lines of this group and where to go for those needs and which needs maybe aren't met. And maybe we can look at, they really do focus, they have within the primary care networks, they actually do have a lot of data around certain things. And so just looking at the lens of how we can get some of that data too, that may support our programs being sustained.
Right.
Okay.
Yes.
Yeah, great.
Yeah. And maybe, and maybe there's some other types of partnerships that can come together for that.
For sure. And they've really grown. And so if you have the chance to look at their Health Quality Council of Alberta, their campaign there, you'll see it. They actually have it on TV as well. So I know in the North Zone, we have health neighborhoods that are developing in different areas, and within the health neighborhoods, some of the work we're doing is we're partnering with them in HQCA. So it's getting the word out there from a community perspective.
Yeah, it'd be interesting, hey, to be able to find what they have that can help tell some of the story of the work that's happening within these groups too, if there's a way of doing that,
sure.
right? Yeah,
for sure.
yeah. Just see in the chat box there from Karen Chan, just wondering, Stephanie, if you knew where kind of that information about being #1 for elder abuse and food insecurity had come from. If you knew, or if you can find it out, you can always send it to us later too.
I can send the link for food security. That was Wendy that had shared
Oh,
about
great.
elder abuse. Yeah.
Oh yes, yeah. Thanks. Okay.
Fastest hour of the day.
Yes, that's right. That's right. Yeah.
I will look for that article and send it to you guys.
Super.
Great. Thanks, Wendy.
Thanks, Wendy. Good. Kate, do we have a next slide there? I think we had maybe. There we go. Just to let people know about our group on CORE, and that this is the way to join the partners meeting now. If you have any difficulties with joining or getting the invites, just let us know. Reach out to Kate, because she's our one for managing that. And our next meeting is, just looking up here, is on
25th,
October
I think.
25th. That's right, at 9:30. So again, we will have probably 2 presentations from the from 2 more community groups that have been involved in the Health Canada grant work. So we look forward to seeing everybody there, and thank you for joining us today. Great discussion. Really important work for us to keep moving this forward, for sure. And thank you to Drumheller especially.
Yeah. Thanks, Drumheller team.
Yeah.
And everyone for your openness. It's awesome. Great
Yes,
space.
thank you. Thanks for having us. We really appreciate the opportunity to present today.
Thanks, Kim.
Awesome. Thanks, Kim.
Have a good week, everyone. Enjoy
great
the
rest of your
nice
day,
weather.
everyone.